Is there any need for other hormones when taking testosterone and pregnenolone? Very general question. How do you answer that?
In general, possibly, maybe, right? We don't know. It really depends on the individual. Again, there are people who will notice a decrease in the upstream hormones. So pregnenolone is one of the upstream. And you also have to look at the HEA, which sometimes is decreased on TRT, and over time, you may benefit from an oral supplementation of about 25 milligrams each morning on the HEA. And you always, got to look at other hormones that are not always sex hormones. You got to look at the thyroid function as well. That can be impacted, and it is dose dependent. We know that anecdotally from guys that run steroid cycles at higher doses, elevated testosterone levels, super physiological levels for extended periods of time are going to have a negative impact on thyroid functions. They do cause hypothyroidism. So we'll notice TSH levels creep up, T4 and T3 creep down, and then over time, people will become dependent on thyroid medications. So take care of your thyroid. Prior to going on thyroid medication, which is so grossly overprescribed, at least in the US, you can look at iodine, sublingual drops. Again, don't overdo it, but iodine is essentially T4. It's the main ingredient for your thyroid to produce T4. And you can look at selenium, 200 micrograms per day, which is also good to sustain thyroid function. So before you go and supplement with exogenous hormones and essentially suppress your glands, try to support them, if you will. So yeah, there are other hormones that we recommend looking at in addition to testosterone. But again, this is case specific, and it is not a blanket policy for every patient.